day everyone, I am Rosemarie Arcega, and together with my groupmates, Irene Abad, Rachel and Belen, Emily Grace Ancheta, Laarni Acena, and Lexcie and Bautista, and we are the Group 1 presenting to you the Musculoskeletal System. Our topic outline would be the introduction to the musculoskeletal system, question for research, labeling, muscles, completion, multiple choice, true or false, defining images, and finally the matching type. So basically, we will be discussing to you the activity 6 in our uh, anatomy and physiology activity 6 in laboratory. And first and foremost, what is musculoskeletal system? Musculoskeletal system includes our bones, joints, muscles, tendons, ligaments, bursae of the body, and it also provides mechanical supports for the body and most importantly protects our internal organ and permits movements. Um, don't you know that our body is composed of 206 bones and each bone plays a very important role in making all the mechanics of our body function. Our bones is composed of many osseous connective tissues having many important functions. They provide a supporting framework of the body, protect viscera or our organs, and also provide a place for attachment of muscles. Bones also store minerals, chiefly calcium salts, that can be used to increase the blood calcium level in circumstances that deplete the blood calcium. Some bones contain red bone marrow that forms red blood cells and some white blood cells. Bones also help destroy old red blood cells. On the other hand, our muscles are composed of contractile fibers, contracts, and relaxes that are organs of locomotion because they provide or they produce movements. And there are over 600 individual muscles in the human body. Muscle tissue comprises about 45% of the total body weight of an adult. And our body has two types of bone. It is the cortical bone and the trabecular bone. You may think of a bone that is hard, dense material, and this is what we call the cortical bone. Cortical bone are primarily the structure bones. On the other hand, trabecular bone is soft and spongy. It's often found inside a large bone and in our pelvis, ribs, and skull. Though it is less dense than the cortical bone, it is still quite hard and protective. Just like what I have said earlier, we have 206 bones in the human skeleton. Our hand includes carpals, metacarpals, and flanges. Our foot includes tarsals, metatarsals, and flanges. Our skeleton includes skull, clavicle, scapula, sternum, ribs, humerus, vertebrae, ulna, radius, sacrum, femur, patella, tibia, and fibula. And for our question for research, our number one question is, what is the membrane that covers the bone? And what is the function of the membrane that covers the bone? The membrane that covers the bone is what we call the periosteum. It is a thin outer membrane covering our bones and is made of tough fibrous tissues which covers the compact bone. It has many functions. Periosteum has cells which are capable of giving rise to the bone, forming the inner layer of the periosteum is also referred to as the cambrium. Periosteum mediates attachment of tendons and ligaments on bone. Periosteum is highly vascularized, hence supplies nutrition to bony tissue. Periosteum also have nerve endings. Periosteum has two layers. It is the inner layer and the outer layer. Inner layer contains osteoblast cells. Thus, it also helps in increasing the diameter of bone. Osteoblasts are bone-forming cells. They are very important during the fetal and childhood phases of life when bone tissue is still developing. As a result, the inner layer of the periosteum is thick and rich in osteoblasts in the fetus and during early childhood. And on the other hand, the outer layer of the periosteum is mostly made of elastic fibrous materials such as the collagen. It also contains blood levels and nerves. The blood vessels of the periosteum contribute to the blood supply of the body's bones. They can pass into the dense and compact layer of bone tissue below, and it is what we call the bone cortex. We also have conditions of periosteum, and this is what we call the periostitis and periosteal chondroma. I hope I am pronouncing it right. If not, sorry po. Anyways, Perios- periostitis is an inflammation of our periosteum. It is caused by an overuse or repetitive stress to muscles and connective tissue. It's often associated with shin splints and a painful condition that tends to affect mostly the runners and the dancers. The other condition is the periosteal chondroma, and it involves a non-cancerous tumor in our periosteum. Periosteal chondroma is a rare condition without any known causes, and these tumors tend to occur in people under age of 30 and affect males more often than females. Question for research number 3. What is another name for the shaft of a long bone? Itong picture po na nakikita niyo sa gilid is an example of a long bone. A long bone has two parts, the diaphysis and the epiphysis. Diaphysis is the tubular shaft that runs between proximal and distal ends of the bone. The hollow region in the diaphysis is called the medullary cavity, which is filled with yellow marrow. Medyo blurred yung image pero ito siya. Yan. Ito yung diaphysis. Makita niyo dyan. Ito. Pasensya na kung medyo blurred po yung picture. Anyways, diaphysis contains the medulla of the bone, which houses bone marrow. The marrow is the primary tissue responsible for the production of erythrocytes, leukocytes, and platelets. Anatomy of a long bone is a typical long bone shows the gross anatomical characteristic of bone. Ito po siya. Number 4. What are the ends of a long bone called? The enlarged end of a long bone are the epiphyses. The epiphysis of a bone articulates with the second bone at a joint. Each epiphysis consists of a thin layer of compact bone overlying spongy bones. The epiphyses are covered by cartilage. And the epiphysis is the terminal end of a long bone that is typically responsible for articulation and is the rounded end of a long bone. Primary function is to connect adjacent bones to form joints. Ayan. Ito po siya. Epiphysis. Ayan, ito. Tapos yan po. Pwede rin po yan. Number 5. Where is compact bone located? Compact bone is located or can be found under the periosteum and in the diaphysis of a long bone, where it provides support and protection. The microscopic structural unit of compact bone is called an osteon or Haversian system. Number 6. Describe the location and function of cancellous bone. Cancellous bone is found in the pelvis, skull, and ribs in adults. It contains cells like stem cells that allow formation of blood cells. Cancellous bone and cortical bone both contain cells that encourage bone remodeling. Next, what are the bone building cells called and where are they located? The bone building cells or the bone forming cells is what we call the osteoblasts, and they are located along the bone surface comprising 6 4 to 6% of the total resident bone cells and are largely known for their bone forming function. The other bone building cells is what we call the mature bone cells or the osteocytes, can be found between the rings of matrix. The bone cells are located in spaces called lacunae or lacunae. I don't know if I am pronouncing it right po, pero yan. And the other bone building cells that break down and reabsorb bone is what we call the osteoclasts. There are two types of ossification, and it is the intramembranous and endochronal, chondral, and that is can be found in pits in the bone surface, which are called resorption base or Hoship's lacunae. Osteoclasts are characterized by a cytoplasm with a homogeneous, foamy appearance. This appearance is due to a high concentration of vesicles and vacuoles. 8. What cells in the osseous tissue regulates the exchange of calcium between blood and bone? Osteoclasts are large bone cells with up to 50 nuclei. They remove bone structure by releasing lysosomal enzyme and acid that dissolve the bony matrix. These minerals release from bones into the blood and help regulate calcium concentration in the body fluids. Number 6. What hormones are involved in the exchange of calcium between bone and blood? Parathyroid hormone regulates calcium levels in the blood, largely by increasing the levels when they are too low. It does this through its action on the kidneys, bones, and intestine. Bones parathyroid hormone stimulates the release of calcium from large calcium stores in the bones into the bloodstream. Number 10. How does composition of the child bone differ from an adult? An adult's bone are harder, more brittle, and more likely to break than bend, while on the child's bone naman po are more flexible because their chemical composition is different from that of adult bones. This means that a kid's bone might bend or bow instead of breaking. Basically speaking, ang child bones is more flexible, kaya hindi madaling mag-break unlike sa adult bone. 11. Discuss the different patterns of bone growth in long bones and in bones of the skull. Intramembranous ossification involves the replacement of sheath-like connective tissue membranes with bony tissue. Bones formed in this manner are called intramembranous bones. They include certain flat bones of the skull and some of the irregular bones. The future bones are first formed as connective tissue membranes. Osteoblasts migrate to the membranes and deposit bony matrix around themselves. When the osteoblasts are surrounded by matrix, they are called osteocytes. Endochondral ossification involves the replacement of hyaline cartilage with bony tissue. Most of the bones of the skeleton are formed in this manner, and these bones are called endochondral bones. And in this process, the future bones are first formed as a hyaline cartilage models. During the third month after conception, the perichondrium that surrounds the hyaline cartilage models become infiltrated with blood vessel and osteoblast and changes into periosteum. And lastly, classify joints according to the type and amount of motion they permit. So, what is this joint that we call? Joints, also known as articulations, are a form of connective between bones. They provide stability to the skeletal system as well as allowing for specialized movement. Kaya po tayo nakaka-bend ng, kunyari ito, daliri. Nabibend po natin siya because of our joints dito po. Yan. Alam ko naman po na alam na po natin ang ibig sabihin ng joints. Ika-classify po natin ang joints according to its structural and function. Fibrous joints are connected by dense, tough connective tissue that is rich in collagen fibers. These fixed or immovable joints are typically interlocked with irregular edges, and there are three types of fibrous joints. Sutures are the type of joints found in the cranium skull. The bones are connected by sharp fibers, while the cartil- cartilaginous joint are connected fibrocartilage or hyaline cartilage, and they allow more movement than the fibrous joints, but less than of a synovial joints. Bali tatlo po sila na joints, fibrous joints, cartilaginous, and the synovial joint. And synovial joint, this is the most common and movable joint type in the body. These joints are also called the diarthroses, have a synovial cavity. Their bones are connected by dense irregular connective tissue that forms an articular capsule surrounding the bone's articulating surfaces. A synovial joint connects bone with the fibrous joint capsule that is continuous with the bone's periosteum. This joint capsules constitutes the other boundary of a synovial cavity and surrounds the bone's articulating surfaces. Synovial cavities are filled with synovial fluid. The knees and elbows are examples of synovial joints. Fibrous joints are fixed or immobile joints that are connected by dense, tough connective tissue that is rich in collagen fibers, while cartilaginous joints are joints connected by fibrocartilage or hyaline cartilage, and they allow more movement than fibrous joints but less than synovial joints. Synovial joints, on the other hand, are joints of very limited mobility. These are found at the articulation between teeth and the socket of maxilla or mandible. Next, we will be describing the following types of joint movements. Abduction. Abduction is a movement away from the body's midline. Pag ganun po siya, pag ganun. Pag ganun. Abduction, on the other hand, is a movement towards the body midline. Kung yung abduction po ay pag ganon, parang hindi ako kasi makaano yun. Ganyan. Pag ganon, yung abduction naman is pag ganon, pagpunta sa katawan. Ito po, kung makikita nyo sa image, ayan. Ang abduction is palayo sa katawan at yung adduction naman is basically papunta sa movement towards the body's midline. Next is the circumduction, allowing the articulating extremity to complete a fluid motion that resembles a full circle at the farthest end of rotating limb. Parang ganyan po. Ganun. Ito po yung joint na nag-aalaw sa atin na i-move yung braso ko. Ganyan. This is what we call the circumduction. Next is the flexion and the extension. Flexion is bending the limbs at a joint. Pag ganun. Bending the limbs at a joint. While the extension is straightening limbs at a joint. Extension. Ganun. Parang palikod. Nangyayari itong flexion extension. Good example nito is while we are walking. The other type is the hyperextension. It is excessive movement of a joint in one direction. In other words, the joint has been forced to move beyond its normal range of motion. When this happens, the tissues around the joint can be damaged. I think mostly nagagamit itong hyperextension tuwing nag-workout tayo. Ito po, parang nakikita natin dito. Kapag nag-move tayo ng joint, may nasasama tayong muscles. And kapag nasobrahan, pwedeng merong tissue around the joint na madadamage. So, ayan, ito. Kung nakikita niyo po sa image, nag-workout po yung, ayan, bababa siya, tapos tatayo. Nasasama itong muscle na to, or the tissues around the joint. Ayan. The next types of joint movement is the internal rotation and external rotation. Internal rotation is the rotating a joint towards the midline. Parang yung kanina lang din po sa yan, abduction and adduction. Rotating towards a joint and rotating a joint away from the middle. Basically speaking, internal rotation is pag ganun po. Pag ganyan. Nakikita niyo po ako pag ganun. While the external is rotating a joint away from the midline. Pag ganun. Yung mas masakit yung external. Ganun. Next is the plantar flexion, a movement in which the top of your foot points away from your leg. You use plantar flexion whenever you stand at the tip of your toes or point your toes. Every person's natural range of movement in this position is different. Ito po minsan kapag nangangalag yung paa natin is minsan ginagalaw natin yung paa natin. Parang ginaganon natin. It is what we call the plantar flexion. And the other movement, joint movement is the dorsiflexion, a backward bending and contracting of your hand or foot. Ayan. Kung yung plantar flexion po is pataas, mula sa baba pataas, yung dorsiflexion naman is pagpababa. Correct me if I'm wrong po, pero yan po ito. Parang nakikita natin sa image, di ba? Pag ganun siya, kasi ito pababa. Ayan. Next is the supination, the opposite motion in which rotation of the ridges returns the bones to there. Ayan. Next is the pronation, the motion that moves the forearm from the supinated or the anatomical position to the pronated or palm backward position. And next is the inversion, or the movement in which the plantar surface of the foot rotates toward the midline of the body. Ayan, ito parang tabingi siya. And the inversion on the other hand is the movement in which the plantar surface of the foot rotates away from the midline of the body. Usually, may mga ganitong instances kapag merong special needs ang tao, diba? Mostly kapag sa mga PW, makikita pa natin yung mga ganitong instances. Yung inversion is mostly nangyayari whenever especially sa mga athletes kagaya ko, kapag nai-sprain, ganon, pag ganito siya. Ito. Mostly yung pinakamasakit dyan is yung muscle, kasi parang nabibinat siya. Yan. And labeling will be discussed by Rachel and Belen.
Good day, ma'am. My name is Rachel and Belen, and I will be explaining or discussing about the labeling. So the first one is the right scapula. So number 1 is the spine. The spine of the scapula or scapular spine is a prominent plate of bone which crosses obliquely the medial 4/5 of the scapula and its upper part and separates the supra from the infraspinatus fossa. So the spine is siya yung nagsiseparate sa supra from infraspinatus fossa. So the number 2 is the glenoid cavity. The glenoid fossa of the scapula or the glenoid cavity is a bone part of the shoulder. So ang tawag sa bone part sa ating shoulder is the glenoid cavity. So this one is the thoracic cage. So number 3 is the manubrium. The manubrium is a roughly trapezoidal bone. It is the widest and thickest of the 3 parts of the sternum. The manubrium forms articulations with the clavicle body of the sternum, first rib, and superior half of the second rib. So number 4 is what you call true ribs, because 1 to 7 ribs are classified as a true ribs. So number 5 is the body. Your thoracic spine is the middle section of your spine. It starts at the base of your neck and ends at the bottom of your ribs. It consists of 12 vertebrae. Your thoracic spine is especially rigid and stable, making it the least common area of injury along your spine. So number 6 is the xiphoid process. It is the most distal edge of the sternum of the breastbone. The sternum contains three major portions: the manubrium, the body, and the xiphoid process. Its name comes from the Greek word xiphos, which means straight sword. Number 7 and 8 considered as a false rib because 8 to 12 are called false ribs. So, they are considered as a false ribs kasi kapag binilang mo, taas hanggang baba is yung number 7 is nasa number 9. While yung number 8 is considered as number 11. What markings on the scapula identify it as a right and left? So, to determine whether a scapula is right or left position is so that the glenoid cavity articulating surface faces laterally outward and the spine is posterior toward the back and superior upper. The coracoid process should be positioned anteriorly and superiorly. So, in what region scapula is located? So, it is located in the upper thoracic region on the dorsal surface of the rib cage. How do you differentiate between true, false, and floating ribs? So, true ribs attach directly to the sternum, while false ribs attach through costal cartilage, and floating ribs have no attachment to the sternum. From the word itself, floating, hindi siya naka-attach sa kahit saan. So this part is the right clavicle and humerus. So the first part is the sternal end. The medial end, known as the sternal end at the clavicle, has a triangular shape and articulates with the manubrium portion of the sternum. Number 2 is the acromial end. The acromial end presents a small flattened oval surface directed obliquely downward, which articulates with the acromion of the scapula. Number 3 is the head of the humerus. The humerus is the bone that forms the upper arm and the joins it to the shoulder and forearm. So number 4 is the greater tubercle. Greater tubercle of the humerus is a bony projection of the lateral part of the proximal end of the humerus. Number 5 is anatomical neck. It is the residual epiphyseal plate. An interbercular groove appears proximally which demarcates the two tubercles vertically. So number 6 is the medial epicondyle. It is the apophysis that serves as a point of attachment for the forearm flexor muscles, the pronator teres, and the medial collateral ligament, or what you call MCL. So number 7 is the olecranon fossa. It is a deep triangular depression on the posterior side of the humerus superior to the trochlea. It provides space for the olecranon of the ulna during extension of the forearm. In what region humerus is located? So humerus, it is a long bone of the upper limb or forelimb of land vertebrates that forms the shoulder joint above, where it articulates with the lateral depression of the shoulder blade or the glenoid cavity of scapula, and the elbow joint below, where it articulates with the projections of the ulna and the radius. So to summarize, it is located at the upper limb or forelimb of land vertebrates. B. How to determine whether humerus is right or left? So the side on which the capitulum faces determines the bone site. If the capitulum is facing the right side or is present on the right side of the bone, then it is the right humerus bone. So if the bone capitulum is present on the left side of the bone, then it is the left humerus bone. So this part naman is the left ulna and radius. So the number 1 is olecranon process. It is the large, blunt proximal tip of the ulna. The rough posterior surface on the olecranon process is the distal attachment for the triceps muscles. So number 2 is the trochlear notch. It is the large jaw-like curvature of the proximal ulna that articulates with the trochlea or of the humerus, forming the humerulnar joint. So number 3 is the neck. The radial neck is the constriction distal to the head. The radial tuberosity is an oval prominence distal to the neck on the medial aspect. which delineates the proximal end, head, and neck of the radius from the shaft. Number 4 is ulna. The ulna is one of the two bones that make up the forearm. The other being the radius, it forms the elbow joint with the humerus and also articulates with the radius both proximally and distally. The next part is the bones of the left wrist and hand. So number 1 is the carpals. Carpal bones are bones of the wrist that connect the distal aspects of the radial and ulnar bones of the forearm of the bases of the 5 metacarpal bones of the hand. There are 8 carpal bones which divide into 2 rows, a proximal row and a distal row. The proximal row of carpal bones, or moving from the radial to ulnar, are the scaphoid, lunate, triquetrum, and pisiform, while the distal row of carpal bones are also from radial to ulnar, comprises the trapezium, trapezoid, capitate, and hamate. Number 2 is the metacarpals. The metacarpals are the 5 long hand bones between the wrist and fingers. They make up the palm of your hand and are visible through the skin on the back of your hand. Each metacarpal bone corresponds to a digital finger and consists of a base, shaft, or body and head. So, yung metacarpals is yung nasa gitna ng ating palm. Number 3 is the phalanges. The 14 bones that are found in the fingers of each hand and also in the toes of each foot. Each finger has 3 phalanges, the distal, middle, and the proximal. The thumb only has 2 metacarpal bones. A. With what bone do the carpals articulate proximally? So the lunate rises above the level of the other carpals in hyperflexion of the wrist joint, making it easy to identify, especially in thin people. The radius proximally the scaphoid, laterally the quadril, medially, and the capitate and hamate distally are the 5 bones that articulate. So the next part is the typical cervical, thoracic, and lumbar vertebrae. Number 1 is the spinous process. The spinous process of a typical cervical vertebra is short and bifid or bifid posteriorly. It is a bifid because it develops from 2 separate secondary centers of ossification. This morphology is unique to cervical spinous processes. Number 2 is the lamina. The lamina is the flattened or arc part of the vertebral arc, forming the roof of the spinal canal, the posterior part of the spinal ring that covers the spinal cord or nerves. So number 3 is the vertebral foramen. The opening in a vertebra that is formed by a neural arc and back portion of a vertebral body and through which the spinal cord passes. Number 4 is transverse process. The transverse processes of typical cervical vertebra project obliquely anteriorly between the sagittal and the coronal planes and are located anterior to the articular process and lateral to the pedicles. So number 5 is the body. Your cervical spine is the neck region of your spinal column or backbone. It consists of your first 7 bones. So the next part, it is your typical thoracic vertebrae. So number 6 is the spinous process. The spinous process or of thoracic vertebrae serves as the attachment size for many muscles and ligaments. Because of the length of the thoracic region, attachment varies somewhat from the upper to lower thoracic vertebrae. So number 7 is your lamina, bony imbrication that covers the subjacent vertebrae and connect with pedicles to protect the spinal cord, intervertebral foramen or paired foramina, one left and one right, intended for the exiting nerve roots. So your number 8 is the costal facet. The superior and inferior costal facets are located on the sides of each vertebral body. They consist of cartilage-lined depressions which articulate with the heads of the ribs. Number 9 is the vertebral foramen. The large opening between the vertebral arc and body is the vertebral foramen, which contains the spinal cord. So number 10 is your body. The body of a thoracic vertebra is somewhat heart-shaped and is larger than the cervical but smaller than the lumbar vertebrae in size. The body also has small, smooth, and somewhat concave costal facets from the attachment of the ribs. So the next part is your lumbar vertebrae. So number 11 is your spinous process. The spinous process is short and thick relative to the size of the vertebra and projects the perpendicularly from the body. So lamina, I discussed it earlier na. Number 14 is your transverse process. The transverse process serves as muscle attachment size and are used as lever arms by spinal muscles. Number 14 is your pedicle. The pedicle are very strong and are directed backwards from the upper part of the vertebral body. So number 15 is the vertebral body of each lumbar vertebra is kidney shaped, wider from side to side than from front to back, and a little thicker in front than in back. It is flattened or slightly concave above and below, concave behind, and deeply constricted in front at the sides. So, yung body ng lumbar is kidney shape siya. A. How many of each vertebrae type are in the body and what are the distinctive feature of each type? The vertebral column is a series of approximately 33 bones called vertebrae, which are separated by intervertebral disc. The column can be divided into 5 different regions, with each region characterized by a different vertebral structure. There are 4 different types of vertebrae: cervical vertebrae, thoracic vertebrae, lumbar vertebrae, and sacrococcygeal vertebrae. Cervical vertebrae are the bones that from the neck making up the first section of the vertebral column. They comprise 7 bones. So, ang tawag sa mga bones na yun is C1, ganun, C2, C3, C4, and etc. This is the naming convention for vertebral bones. So, thoracic vertebrae, there are 12 thoracic vertebral bones referred to as T1 to T12. When you think of a thoracic region, the first thing that comes to mind is the rib cage. The rib cage lies in the thoracic region of the body, and the thoracic vertebrae have a slight modification in order to articulate with the ribs. Lumbar vertebrae, there are 5 lumbar vertebrae designated as L1 to L5. These are the largest vertebrae and have huge bodies. They bear the weight of the body and have a great capacity for movement. So the last one is the sacrococcygeal vertebrae. More than often than not, the sacrum and coccyx are studied together as the sacrococcygeal region. The sacrum consists of 5 bones that fuse together to form a single bone, while the coccyx consists of 3 to 5 bones that typically do the same. So B, describe the sacrum. The sacrum is a shield-shaped bony structure related to the pelvis and placed near the base of the lumbar vertebrae. The sacrum reinforces to stabilizes the pelvis by forming the posterior pelvic wall. The next part is the left innominate. Number 1 is the iliac crest. The iliac crest is the ilium's top border, the largest of the 3 bones that make up the pelvis. Number 2 is the iliac fossa. This fossa forms the smooth posterolateral wall of the greater pelvis and is bounded superiorly by the inner lip of the iliac crest, inferiorly by the arcuate line, anteriorly by the anterior border of the ilium, and posteriorly by the medial border which separates it from the sacropelvic surface. Number 3 is the acetabulum. The acetabulum is the cup-shaped socket on the lateral aspect of the pelvis which articulates with the head of the femur to form the hip joint. Number 4 is the ramus of ischium. Ramus of ichthyum extends anteromedially from the inferior aspect of the body to join the inferior pubic ramus. Number 5 is the obturator foramen. The obturator foramen is the large, obliquely oriented, ovoid aperture located at the anterior aspect of both sides of the pelvis, bounded by parts of the ischium and pubis. A. What makes up the pelvic girdle? The pelvic spine and the pelvic girdle can be distinguished when discussing the pelvis. The pelvic girdle, also known as the os coxae, Latin for bone of the hip, is made up of the fused bones known as the ilium, scium, and pubis. B. What markings on the innominate identify it as belonging on the right or left side? In order to determine if a hip bone is right or left, place the bone on yourself with the iliac crest superior, hold it with acetabulum facing laterally outward, and the obturator foramen inferior down. Now, all you need to do is to determine which side is anterior versus posterior, which can be done by looking for the rough pubic symphysis or at the anterior that is at the midline to meet its fellow hip bone at the other side. C. How does the bony structure of a male pelvis differ from the female? The general structure of the female pelvis is thinner and less dense in comparison, which is designed to support a heavier body build. The true pelvis is wide and shallow in the female, and the pelvic inlet, also known as the superior pelvic aperture, is wide, oval, and rounded. The next part is the left femur. Number 1 is the lesser trochanter. The lesser trochanter of the femur is a conical eminence which varies in size in different species. Lesser trochanter left hip joint open by removing the floor of the acetabulum from the within the pelvis upper extremity of the right femur viewed from behind and above. Number 2 is shaft. Your thigh bone in femur is the longest and strongest bone in your body. Because the femur is so strong, it usually takes a lot of force to break it. Number 3 is the medial and lateral condyle. The medial femoral condyle is located on the inside part of the knee, whereas the lateral femoral condyle, which is bigger, is located on the outside part of the knee. So, yung nasa loob niya is yung medial, yung mas maliit. Tapos, yung nasa labas naman is yung lateral condyle, which is mas malaki siya. Number 4 is head. Your femoral head is the upper ball, part of your thigh bone or in the femur that fits into the sockets, part of your hip joint that is part of your pelvis. It is covered by cartilage. Number 5 is your neck. The femoral neck or neck of the femur is a flattened pyramidal process of bone connecting the femoral head with the femoral shaft and forming with the latter a wide angle opening medial ward. Number 6 is your greater trochanter. The bony bump over the side of the hip is called the greater trochanter. A tight band about 2 inches wide, called the IT band, passes over this bump from the pelvis on its way down the leg. Your number 7 is intercondylar fossa. The intercondylar fossa of a femur in the intercondyloid fossa of the femur. Intercondylar notch of femur is a deep notch between the rear surfaces of the medial and lateral epicondyle of the femur. Two protrusions on the distal end of the femur in the thigh bone that joins the knee. A. In what region of the body is the femur located? So the femur is also called a thigh bone, upper bone of the leg or hind leg. The head forms a ball and socket joint with the hip at the acetabulum, being held in place by a ligamentum teres femoris within the socket and by strong and surrounding ligaments. So to summarize, the femur is located at the upper bone of the leg or hind leg. B. What markings on the femur identify it as a right or left? In order to distinguish right from left, or first orient the bone so that the rounded head is superior up and pointing medially towards the body's midline. Then you will need to determine the anterior versus posterior side. On the femur, look for the patellar surface, which is anterior. Also note how the articulating surfaces on the condyles extends far back on the posterior side since the knee bends back but not forward. The specimen below is from the right side. See, the femur articulates distally with the tibia. The next part is your left tibia and fibula. Number 1 is your tibial tuberosity. The tibial tuberosity is the bump on the top of the tibia shin bone where the patellar tendon connects. Tendon connect muscles to bones. The patellar tendon stretches over the top of the patella in the kneecap. Number 2 is your fibula. The fibula, sometimes called the calf bone. It is smaller than the tibia and runs beside it. The top end of the fibula is located below the knee joint but it's not part of the joint itself. The lower end of the fibula forms the outer part of the ankle joint. Number 3 is your tibia. The tibia is a larger bone on the inside and the fibula is a smaller bone on the outside. That much thicker than the fibula, it is the main weight-bearing bone of the two. So your fibula is smaller than tibia. So mas malaking tibia kaysa sa fibula. Number 4 is medial malleolus. You probably know the medial malleolus at the bump that protrude on the inner side of your ankle. It is actually not a separate bone, but the end of your larger leg bone, the tibia or shin bone. Number 5 is your lateral malleolus. The lateral malleolus is the bone on the outside of the fibula. A lateral malleolus fracture is a type of ankle fracture that occurs when the fibula fractures just above the ankle joint. Question A. Where are these two bones located? So the tibia and fibula are located in the lower leg. So question B. Which one is lateral? So as you can see here in the picture, the fibula is lateral. So C. Name the bone with which they articulate distally. So both the smooth surface on the inside of the medial malleolus and the smooth area of the distal end of the tibia articulate with the talus bone of the foot as part of the ankle joint. On the lateral side of the distal tibia is a wide groove called the fibular notch. So the bone that is articulate distally is the tibia.
Good day everyone, my name is Ancheta and I'm going to explain some parts of our bones. Left ankle and foot. Number 1, talus. The talus is the bone that makes up the lower part of the ankle joint. Number 2, tarsal bones. A set of 7 irregularly shaped bones of the midfoot that form the foot arch. The tarsal bones include the calcaneus, talus, cuboid, navicular, and the medial middle and the lateral cuneiforms. Calcaneus, the heel bone and the largest bone of the foot. Number 3, navicular. The navicular is an intermediate tarsal bone on the medial side of the foot, which articulates proximally with the talus. Number 4, metatarsals. The metatarsals bones are the bones of the forefoot that connect the distal aspect of the cuneiforms bone and cuboid bone to the base of the 5 phalanges of the foot. There are 5 metatarsal bones numbered 1 to 5 from the hallux to the small toe. Number 5, phalanges, also known as the great toe or hallux, is the only one to have 2 phalanges. The other lesser toes have 3. These are known as the proximal phalanx and the distal phalanx. Skull lateral view. Number 1, frontal bone. The frontal bone plays a vital role in supporting and protecting the delicate nervous tissue of the brain. It gives shape into the skull and supports several muscles of the head. 2. Parietal bone. The parietal bones are bilateral skull bones that form the superior and lateral walls of the cranium. 3. Occipital bone. The occipital bone is set at the rear of the cranium and articulates with the temporals, sphenoid, parietals, and the uppermost vertebra and the atlas. The foramen magnum is the large hole in the occipital through which the brainstem passes superiorly into the vertebral canal. 4. Sphenoid bone. The sphenoid is just one of the 22 bones that form the skull and essentially helps to connect the neocranium to the facial skeleton. It is a single bone in the midline of the cranial cavity situated posterior to the frontal bone but anterior to the occipital. 5. Nasal bone. The nasal bone is located medial to the frontal processes of the maxillae. The nasal bone is a small flat bone of the skull. Lacrimal bone. The lacrimal bone is a small facial bone that forms a portion of the anterior medial wall of the orbit. 7. Temporal bone. The temporal bones are two major bones in the skull or cranium. They help form the sides and base of the skull, where they protect the temporal lobe of the brain and surround to the ear canal. 8. Zygomatic bone. It's also called cheekbone or malar bone. Diamond-shaped bone below and lateral to the orbit or eye socket at the widest part of the cheek. 9. Mastoid process. A process is a bulging bony outgrowth of the larger bone. An example is the mastoid process, which is easily perceivable from behind the ear and to which many head muscles are attached. 10. Maxilla. The maxilla is the bone that forms your upper jaw. The right and left halves of the maxilla are irregularly shaped bones that fuse together in the middle of the skull, below the nose, in an area known as the intermaxillary suture. Skull. Frontal view. Frontal. The frontal bone is the single bone that forms the forehead. Parietal bone. The parietal bones are bilateral skull bones that form the superior and lateral walls of the cranium. Nasal bone. The nasal bones, along with the frontal process of the maxilla. Ethmoid. The ethmoid bone is a single midline bone that forms the roof and lateral walls of the upper nasal cavity, the upper portion of the nasal septum, and contributes to the medial wall of the orbit. Zygomatic bone. The zygomatic bone is nearly quadrangular in shape and it features 3 surfaces, 5 borders, and 2 processes. Nasal septum. The anterior nasal septum is formed by the septal cartilage, a flexible plate that fills in the gap between the perpendicular plate of the ethmoid and vomer bones. Middle nasal concha. It is a part of the ethmoid bone. Vomer bones. Located in the center of the nasal cavity, the vomer is a thin, unpaired bones of the face and skull. Maxilla. The maxilla is the bone that forms your upper jaw. The right and left halves of the maxilla are irregularly shaped bones that fuse together in the middle of the skull, below the nose, in an area known as the intermaxillary sutures. Base of skull, external view. Number 1. Palatine process. A process of maximilla that projects medially, articulates posteriorly with the palatine bone, and the forms with the corresponding process on the other side, the anterior 3/4 of the hard palate. 2. Zygomatic bone. It's also called cheekbone or malar bone. Diamond-shaped bone below and lateral to the orbit or eye socket at the widest part of the cheek. Palatine bone. The palatine bones are two irregular bones of the facial skeleton in many animal species located above the uvula in the throat. Vomer. The vomer is a midline bone that attaches from the inferior surface of the body of the sphenoid to the superior surface of the hard palate. 5. Articular tubercle, the smooth ridge located immediately anterior to the mandibular fossa. 6. Occipital condyle, a single rounded projection that is present on the rear of the skull and articulates with the first cervical vertebra. 7. Foramen magnum. The foramen magnum is the largest foramen of the skull. It is located in the most inferior portion of the cranial fossa as a part of the occipital bone. Occipital bone. Occipital bone forming the back and back part of the base of the cranium, the part of the skull that encloses the brain. 9. Anterior cranial fossa. The anterior cranial fossa is the depression in the cranial base which primarily supports the large frontal lobes of the cerebral hemispheres. Number 10. Crista galli. The crista galli is a small upward bony projection located at the midline. It functions as an anterior attachment point for one of the covering layers of the brain. 11. Cribriform plate. The cribriform plate forms the very narrow roof of the nasal cavity. Here we can see it from the below. 12 and 13. Sphenoid bone. The occipital bone is a set of rear of the cranium and articulates with the temporal sphenoid, parietals, and the uppermost vertebra. The atlas A. The foramen magnum is the large hole in the occipital through which the brainstem passes inferiorly into the vertebral canal. 14. Sella turcica. The sella turcica is a midline depression in the sphenoid bone which contains the pituitary gland and distal portion of the pituitary stalk. 15. Temporal bone. These are the two major bones in the skull or cranium. 16. Foramen magnum. The foramen magnum is the largest foramen of the skull. It is located in the most inferior portion of the cranial fossa as a part of the occipital bone. 17. Occipital bone. Occipital. Bone forming the back and the back part of the base of the cranium, the part of the skull that encloses the brain. And this is the skull sagittal section. Number 1, frontal bone. This is the frontal bone. It is a single bone that forms the forehead. Parietal bone. The parietal bone are bilateral skull bone that form the superior and lateral walls of the cranium. Occipital bone. Occipital bone forming the back and the back of the base of the cranium, the part of the skull that encloses of the brain. The temporal bones are two major in the skull or cranium. 5. Hypophyseal fossa. The hypophyseal fossa is situated in the center of the base of the skull. And the last one is frontal sinus. A type of paranasal sinus. There are two large frontal sinuses in the frontal bone which form the lower part of the forehead and reaches over the eye sockets and eyebrows. 7. Supraorbital foramen. The supraorbital foramen or notch is the small opening at the central edge of the superior orbital margin and the frontal bone just below the supraciliary arches that transmits the supraorbital nerve, artery, and vein. 8. Vomer. The vomer is a small, thin, plow-shaped midline bone that occupies and divides nasal cavity. Number 9. Sphenoid bone. The occipital bone is a set at the rear of the cranium and articulates with the temporals, sphenoid, parietals, and the uppermost vertebra. The atlas A. The foramen magnum is the large hole in the occipital through which the brainstem passes inferiorly into the vertebral canal. 10. Zygomatic bone. It is also called cheekbone or malar bone, diamond shape, bone below and lateral to the orbit or eye socket at the widest part of the cheek. 11. Maxilla. The maxilla bone is formed your upper jaw. The right and left halves of the maxilla are irregularly shaped bones that fuse together in the middle of the skull below the nose in an area known as the intermaxillary sutures. 12. Mental foramen. A small foramen situated in an anterolateral aspect of the body of the mandible. A. The sutures between the frontal and parietal bone is coronal suture. B. The suture between the two parietal bone is sagittal suture. C. The suture between the two parietal bone is sagittal suture. The suture between the occipital and parietal bone is lambdoid suture. The suture between the temporal and parietal bone is squamosal suture. E. List the cranial sinuses. 4 sets of paired sinuses are recognized: maxillary, frontal, sphenoid, and ethmoid sinuses, anterior and sectioned views. F. Which of these sinuses does not drain into the nose? The answer is chronic sinusitis occurs when the spaces inside your nose and head are swollen and inflamed for 3 months or longer despite treatment. This common condition interferes with the ways of mucus normally drains and makes your nose stuffy. G. What are the functions of the cranial sinuses? They are centered on the nasal cavity and have various functions, including lightening the weight of the head, humidifying and heating inhaled air, increasing the resonance of speech, and serving as a crumple zone to protect the vital structures in the event of facial trauma.